Okay, so this is going to be a part two to the previous video I did on what thyroid nodules are. So this video is going to talk a little bit more about what happens if you are discovered to have a thyroid nodule. So um, typically you'll be referred to someone like me. Sometimes you may end up seeing an endocrine doctor or a general surgeon or another specialist. But what all of us are going to do is we'll review whatever x-ray or imaging test that was done that discovered the nodule. So usually this is an ultrasound, sometimes it's a CT scan or an MRI. And we'll kind of see, how big is this nodule, where is it, do you have more than one nodule, and ask those sorts of questions. So typically what happens is if one or more of the thyroid nodules are greater than 1 centimeter in size, that means they're large enough that we can reliably find out what the nodule is. So if a nodule is less than 1 centimeter, which is very small, it's actually too small to reliably biopsy. So in the cases of small nodules less than 1 centimeter, usually I just recommend following them by doing another ultrasound in 6 months to a year and seeing if the nodules grow or not. So for larger nodules greater than 1 centimeter, the testing I recommend at that point would be to do something called a fine needle biopsy. And this is normally done by a radiologist, and they basically use an ultrasound to look at the nodule in your neck and then to place a very, very small needle directly into the nodule so that they can get some cells out that way. And by doing that, they can look at those cells under the microscope and give us an idea if the nodule looks benign or if it looks like it might be something more serious like a thyroid cancer. And these needle biopsies are usually fairly reliable. Sometimes, of course, they're sort of uncertain or non-diagnostic results, but these days there's actually some genetic testing and other lab tests that can be done to help further figure out what's going on. So, at that point, we have a decision to make. If the needle biopsy shows that the nodule is likely benign, usually in that case, we just watch it with ultrasounds every year or so, and as long as there's no symptoms and no problems, nothing more needs to be done. So obviously, if the needle biopsy looks like it's a thyroid cancer, usually you would need to be set up to have surgery and treatment for the cancer at that point. And obviously, if it's one of these non-diagnostic or something else, there may be further tests or further things to try and figure that out. So anyway, I hope that was helpful for you. It gives you an idea of what to expect if you have a thyroid nodule. And the good news is most of the time, these needle biopsies come back and it looks benign. So that's the best result. And when that happens, usually we can just watch things and you can have some peace of mind that there's no big problem. So I hope that was helpful for you, and I'd be happy to see you for any thyroid nodules or other problems you may have.